We're still talking about ischemic heart disease here. So the last two parts we're covering, we already covered unstable angina, stable angina, Prinzmetal angina, and now we're talking about myocardial infarction and chronic ischemic heart disease. So starting off here with myocardial infarction, both unstable angina and stable angina and Prinzmetal angina, all those conditions, there was reversible damage to the myocytes. The damage, the myocytes would swell. It was less than 20 minutes duration of pain, so the myocytes, cardiac myocytes, survived. With stable angina, the person could just rest or take nitroglycerin, and the symptoms would go away. With an unstable angina, the person could take the person rest wouldn't fix it. The person had to take nitroglycerin to relieve it. In the case of a Prinzmetal angina, the person could take nitroglycerin or a calcium channel blocker, and it would fix it. And it had nothing to do with rest or physical activity. Prinzmetal angina was just a spasm. In the case of myocardial infarction, this is where rest doesn't fix it. It's already dead. The myocytes are already dead. Nitroglycerin doesn't fix it. It's already dead. The myocytes are already dead. So let's talk about what happens here. So what happens in the case of myocardial infarction? It's necrosis of cardiac myocytes. It's going to be due to a rupture of the atherosclerotic plaque with thrombosis and complete coronary artery occlusion. So let's say here's our heart, and we have this coronary artery going into our heart. Here's an atherosclerotic plaque. Let's say before it was blocking off, greater than 70% of the blood flow. Well, this thing formed an atherosclerotic plaque, it ruptured, exposed some collagen, started the whole clotting cascade. We got a thrombosis. The thrombosis blocks off all of the blood flowing through the coronary artery, and we end up with an ischemic area that ends up dying and becoming necrotic, meaning that the muscle cells die and they go away, and you don't make new muscle cells. It's cardiac muscle cells. So other causes besides the rupture of an atherosclerotic plaque with thrombosis and complete coronary artery occlusion could be coronary artery vasospasm, like a Prinzmetal angina that just lasts greater than 20 minutes, or an emboli. So if let's say a person had somewhere an emboli that was floating like a blood clot floating around in their blood and just happens to get clogged right there in that coronary artery, that could cause it. Or they could have vasculitis, such as Kawasaki's disease. Where the vasculitis is basically that the person, here's the blood vessel, coronary artery going in, and this all gets inflamed, and then the inflammation, everything causes collagen to be exposed, and then you get a thrombus in here, and then it's the same kind of thing, but except for it's from vasculitis as opposed to an atherosclerotic plaque rupturing. So some of the symptoms of this is going to be, remember before with a stable angina, it was you had some heart pain for less than 20 minutes, or some chest pain for less than 20 minutes, and radiated into your left arm and your jaw, but it went away when you stopped resting. And unstable angina, even when you rested, it didn't go away. You had to take nitroglycerin. And a Prinzmetal angina is that it had nothing to do with exercise or rest, or whatever. Sorry, both the other ones, unstable and stable, were both initiated with exercise. So with a myocardial infarction, it's severe crushing chest pain for greater than 20 minutes that also, again, radiates to the left arm and the jaw possibly. You're also, similar symptoms as the other one, diaphoresis, which is sweating, dyspnea, which is shortness of breath. Remember, when you get left ventricular heart failure, or you get heart failure, whatever, it ends up backing up into pulmonary circulation. The blood pressure gets too much pressure there, and so there ends up being fluid that flows into the lungs because of the pressure differential on the alveoli, and that makes it so that you have that shortness of breath. And then also the symptoms are not relieved by nitroglycerin. Even if they give them nitroglycerin, this expands, but it's still filling the whole thing. It's all clogged. It's not relieving it. Whereas before, if it was a stable angina or an unstable angina, or maybe even a Prinzmetal angina, if you give them nitroglycerin, it expands a little bit, enough blood's able to get through that they're going to be okay. Next is usually it involves the left ventricle only. Rarely does it include the atria or the right ventricle. So it's typically just the left ventricle. And that's pretty much all we need to know about myocardial infarction for this. Moving on to chronic ischemic heart disease. In the case of chronic ischemic heart disease, this is where you have poor myocardial function due to chronic ischemic damage. And that could be with or without myocardial infarction. And it progresses to congestive heart failure. So when a person has poor myocardial function due to chronic ischemic damage, and it progresses to congestive heart failure, the person has chronic ischemic heart disease.